Good evening, everyone. Welcome and thank you for joining us at tonight's webinar, where we will be sharing information about the human papillomavirus, also known as HPV, and the highly effective HPV vaccine. The HPV vaccine delivers on a dream many have held for decades, a cancer prevention vaccine. My name is Juliane Lee, and I'm Cancer Control Manager at the American Cancer Society and co-moderator for tonight's event. Increasing HPV vaccination is one of the top priorities of the American Cancer Society. And so we are so pleased to collaborate with our valued community partner, Kaiser Permanente East Bay, on tonight's event. Regarding questions that pop up during the hour, we will do our best to get to all questions as we can towards the end of our call on the Q&A segment. Just submit your questions or comments throughout the presentation via the Q&A panel that's on the right, it should be at the right of your screen. We will then compile them throughout the hour and look forward to your questions and comments. I just want to note that, as you heard, we are recording tonight's event, and I'll say more about the recording at the end of the event. For optimal viewing, please be sure to select via view mode, the speaker mode. Now, I'm sorry, our technical person, the electricity went out in Alameda, in the ACS Alameda office. So I'm now going to switch back to our, well, anyway, let me just proceed and then I'll start the panel once we're ready to open the first module. Tonight, in addition to our fabulous survivor speaker, Anna Reyes, a panel of trusted experts, including a primary care physician, head and neck surgeon, and OBGYN obstetrician gynecologist will help answer any questions you may have about the highly effective HPV vaccine. And again, its important role that it serves in cancer prevention. It is now my privilege to introduce our moderator. Dr. Adnan Khan grew up in Fresno, California. He completed his medical training in Detroit at Wayne State School of Medicine, where he developed an interest in the field of oncology, which is the study of cancer. Dr. Khan then moved here to the East Bay for his residency at Kaiser, Oakland, where he honed in on the importance of battling through the various methods of cancer prevention, focusing mainly on vaccinations. Next year, Dr. Khan will be continuing his medical training by pursuing a fellowship in the field of oncology.
Perfect, we can see it.
Wonderful. So as I'd mentioned, everyone, this is the agenda and what we have lined up tonight. We have our fabulous survivor speaker, Anna Reyes, along with a panel of experts, Doctors Janet Lai, Carolyn Barnhart, and Kevin Wang. Now I'm going to move on to our moderator, Dr. Adnan Khan. Now, Dr. Khan, I can hand it over to you. Thank you.
Thank you. Thank you, Juliane, for the introduction. And thank you, everyone, for joining us today for this exciting event where we're going to learn together how one vaccine can help prevent 6 different types of cancers. So by the end of this session, our goal is that you should know exactly what the human papillomavirus is, understand how the HPV vaccine works for cancer prevention, and get any of your questions answered regarding HPV or the HPV vaccine. Next slide, please. So you may be wondering, why is all of this relevant at all, and why is it important to us? HPV is the major cause of cervical cancer in women, with over 90% of cases linked to HPV. HPV is also the major cause of penile cancers in men, and it is the primary cause of anal and oral cancers in men and women. Next slide, please. Overall, HPV causes 6 different types of cancers that can affect men and women, as can be seen here. So it is a very dangerous virus that we have a very strong method of protection against. Next slide. Apart from cancers, HPV is also a primary cause of warts, which can be anywhere on our body, but most commonly they're seen on our hands, our feet, and our genitals. Next slide. So what is HPV? What is human papillomavirus? HPV is the most common sexually transmitted infection, which means it is spread through intimate skin-to-skin contact. HPV is a virus that enters our body through breaks in our skin, small cuts, sometimes cuts that may be too small for us to even be able to see. So if we look at the picture here, this is a close-up picture of our skin, which is made up of multiple layers of cells that can be seen. HPV basically enters our body through breaks in our skin that can be seen in the middle of the picture. Once there, it enters our cells and uses the materials of our cells to replicate and make more and more copies of itself and starts infecting cells around it. You are now at risk of the complications of HPV. Next slide, please. So there's several different types of human papillomaviruses, over 150 to be more specific, and each one causes a different outcome. Those outcomes can be cancers or warts, as we discussed. Low-risk HPV types, which can be seen on the right side of the screen, are low risk because they rarely cause cancers. These are the ones that are causing warts. It's important to note that people could have a low-risk strain and still not show any signs or symptoms ever in their lives of HPV. Now, high-risk strains, which are on the left side of the screen, these are the ones that can cause cancers in men and women, and these are the cancers that we discussed earlier. Next slide, please. So how does HPV become the most common sexually transmitted infection? One type of HPV can be spread through physical contact, thought to be through the small cuts on our skin, allowing those virus-containing cells we talked about earlier to be shed into the wounded site. These are the ones that cause skin warts, and they can occur anywhere on our bodies, but most commonly on our hands and feet and our genitals. Genital HPV is spread through intimate skin-to-skin contact because the skin in those areas is far more delicate than anywhere else on our body. This intimate contact includes body surfaces called mucosa, which are the inner lining that touches during kissing or during sex, whether that's oral sex, anal sex, or vaginal. One very important point to note is that HPV is not spread through bodily fluids, and that could be blood, it could be mucus, or even semen. This is important because barrier methods such as condoms may provide some protection, but it's not complete because body parts that are not covered by a barrier will not be protected. Next slide, please. Now that we know more about HPV and how it's spread and all of its complications, we can get to the most important point, which is how do we prevent HPV from affecting us? The HPV vaccine is recommended for all men and women. That's very important. It can be given as early as age 9, and for now, it's approved for those up into the age of 26. Recently, actually, the US Food and Drug Administration approved the vaccine for those up until the age of 45. But if you're over the age of 26, then it's recommended that you speak to your physician before getting the vaccine. And we'll talk about why that might be. For those over the age of 15, the vaccine is given as 3 doses over 6 months. The optimal time for the vaccine is prior to your sexual debut, as those are the individuals that have the best chance of not having been infected with any of the strains of the virus. However, that is not a requirement, meaning you can still get the vaccine even if you have already been sexually active, because the vaccine will still help decrease your risk of exposure to all the other HPV types that we spoke about. Next slide, please. So the HPV vaccine is an inactivated vaccine, meaning it can in no way cause disease-like symptoms or HPV disease in those that receive it. The vaccine is given similar to most other vaccines with an injection in your arm. And as previously mentioned, it's important to get the vaccine before your sexual debut, but it is just as safe and highly effective even after your sexual debut. The only people who should not get the HPV vaccine are those that have had an allergic reaction to one of the HPV vaccine doses in the past and pregnant women. This is because even though the vaccine has been shown to be effective against HPV for the mother and the baby, these studies are still ongoing. Next slide, please. So in summary, HPV is a virus that can cause 6 different types of cancers and genital warts. HPV is spread through intimate skin-to-skin contact through our delicate mucosal surfaces, as we discussed. The HPV vaccine is safe and effective for all that receive it. The HPV vaccine can prevent over 90% of the complications caused by the human papillomavirus. Now I'm going to turn it over to our incredible guest speaker, Ms. Anna Reyes. Anna is an educator, advocate, a mother of 2, and a cervical cancer survivor. In 2015, at the age of 35, Anna was diagnosed with HPV-related cervical cancer. She fought a year-long battle to overcome this diagnosis, only to be told that she had more precancerous lesions caused by HPV in 2017. She recently received this diagnosis once again and is currently doing chemotherapy to treat these precancerous lesions. Anna is a Kaiser patient, an American Cancer Society ambassador, and a survivor ambassador. When she isn't out spreading the word about the importance of the HPV vaccine as cancer prevention, she enjoys being at home with her family. Thank you for being here with us, Anna.
Thank you. Before I begin, I want to say that I want to dedicate this advocacy work to a dear friend of mine whose name is Becky. She passed away on Tuesday. She was 37. She had 2 young daughters, ages 6 and 8, and she died from cervical cancer caused by HPV. So I am here tonight as kind of the face of what HPV and HPV-related cancers can look like. I'm going to be speaking about my experience with cancer caused by HPV. And in order to do that, I'm going to be talking about intimate parts of my body. If someone had told me 7 years ago that I would be posting on Facebook and Instagram about my cervix and vagina, I would have laughed hysterically. If someone had told me 7 years ago that I would be a speaker at both local and national events and the topic would be my cervix and my vagina, I would have just walked away at the absolute ridiculousness. If someone told me 7 years ago that I would be diagnosed with cancer of any kind, especially cervical cancer, I would have said, absolutely not. I go to my well woman exams every year. I stay on top of my health exams. I'm all good. And if someone told me that 5 years after my diagnosis, I would still be dealing with HPV and cancer, I would have sobbed. And yet here I am. I was diagnosed with stage 2 cervical adenocarcinoma in December of 2015. My cervical cancer, as most cervical cancers are, is caused by HPV. At the time I was diagnosed, I was a single mother to 2 young children. I was treated at Kaiser in Santa Clara, which has one of the best reputations in the country for the treatment of cervical cancer. My treatment consisted of the removal of my fallopian tubes and relocation of my ovaries out of the field of radiation to try to preserve their function so that I wouldn't go into menopause. I then underwent 6 weeks of chemotherapy, 28 rounds of external radiation, and 3 rounds of internal radiation, where a radioactive ring is placed directly on your cervix and left there for a few hours before being removed. It was excruciating and exhausting. I had multiple surgeries. I went into menopause at the age of 36. I had a radical hysterectomy, and the option of having more children was taken away from me. I had to have reconstructive surgery on my bladder and ureters due to radiation damage. I had to take a leave of absence from my job for a full year. I currently live with daily side effects, both physical and mental, from my cervical cancer treatments. I had to move back in with my parents and rely on them for absolutely everything. After my battle with cervical cancer, I thought I was done with HPV, but I was wrong. My body has never been able to fight off HPV. It continues to be active in my system, and it continues to cause cancer-related problems for me. In 2017, I was diagnosed with precancerous lesions on my vaginal wall, also caused by HPV. More chemo, more side effects, more anxiety, and more fear came with that diagnosis. The chemo that I took then worked, and those lesions were gone. And again, I thought I was done. But no. In September of this year, I was again diagnosed with HPV-related lesions on my vaginal wall. This latest diagnosis has almost wrecked me. I am back in chemo for at least 8 weeks, and then I will have biopsies done again. I'm potentially looking at a surgery that will affect my life forever, a surgery that would take away my ability to be intimate with my husband forever. But I still consider myself lucky. There's the obvious reasons to consider myself lucky. I'm alive, but there are other reasons as well. I'm lucky because my children will never have to face this disease. They have both received the HPV vaccination, which prevents cervical cancer as well as 6 other types of cancer. This vaccine was easy for me to get for my children and was fully covered by my insurance. Here's the thing about HPV. 80% of sexually active adults will contract HPV at some point in their life. So if you are having sex, or if you plan to ever have sex at any point in your life, you will most likely be exposed to HPV, which means you are being exposed to a virus that could potentially cause cancer. There are many myths about the HPV vaccine, and I'd like to address some of them here. The internet is a scary place because, as you all well know, people can post whatever they want, whether it's based in research and science or not. Anytime you hear about a crazy side effect of the HPV vaccine, please look to see if it's from a reputable site, such as ACS or the CDC. There are 6 myths that I want to discuss. The first myth is that the HPV vaccination is not safe and is relatively new. The HPV vaccine is safe and it doesn't contribute to any serious health issues. Like any vaccine or medicine, the vaccine may cause mild reactions. The most common are pain or redness in the arm where the shot is given. Rarely, an allergic reaction can occur, and individuals should not get the vaccine if they are allergic to any of the components. But crazy reports of people starting to walk backwards or dying immediately after receiving the vaccine are unfounded and based on pure anecdotes. My mother's sisters, cousins, best friend's daughter, fill in the blank. The vaccine itself has been researched for many years, including at least 10 years of research before it could even be used in humans, and it is highly monitored by the FDA. Vaccinations in the US have never been safer because of the stringent standards that the FDA uses. The HPV vaccine has actually been around longer than Facebook and longer than the iPhone. The second myth is that the HPV vaccination can lead to infertility. The fact is that claims of HPV vaccine-induced infertility due to premature ovarian failure are all anecdotal and not backed by research or clinical trials. In fact, the HPV vaccine can actually help protect fertility by preventing gynecologic problems related to treatment of cervical cancer. And as I said, that happened to me. I went into menopause at 36 and was unable to have any more children. I also had my fertility taken away prior to my hysterectomy because my ovaries stopped working. The third myth is that the HPV vaccination is not effective at preventing cervical cancer. But the fact is that in studies that led to the approval of the HPV vaccine, the vaccine provided nearly 100% protection against persistent cervical infections with 2 of the most dangerous types of HPV, type 16 and 18, and the precancers that those persistent infections can cause. In addition, a clinical trial of HPV vaccine in men indicated that they can prevent anal cell changes caused by persistent infection and genital warts. HPV-associated cancers can take decades to develop, so it will be a few more years before we will have studies comparing cancer rates. Advanced precancers have long been universally accepted markers for cancer developing. The fourth myth is that only girls need to get the HPV vaccine. Men and boys don't need it. But the fact is that HPV affects both men and women. It can cause genital warts, penile, anal, and oral cancer in men. It can also be easily transmitted from a sexual partner without either of the partners knowing. So by men getting the vaccine, they're preventing potential HPV infections in their partners. The fifth myth is that the HPV vaccine doesn't protect against enough strains of the human papillomavirus to be worth getting. The current HPV vaccination protects against 9 types of HPV. These 9 types have been linked to more than 90% of genital wart cases, 90% of cervical cancer, and 70% of anal cancer diagnoses. The vaccination is highly protective to prevent this very common viral infection and to help prevent genital warts and cancers. And then the sixth myth is that HPV is uncommon and it's unlikely that I'll get infected, so there's no need for me to get the vaccine. But the fact is that genital HPV infection is the most common sexually transmitted infection, and there are over 14 million new infections each year in the United States. It's so common that nearly every male and female will be infected with at least one type of HPV at least once in their lifetime. And currently, over 80 million Americans are infected. The HPV vaccine is a safe and effective way to prevent cervical cancer from ever occurring. Estimates of the cost of the HPV vaccine range from $4.50 to $13, making the HPV vaccine one of the most cost-effective cancer prevention methods out there. We have the tools to make my generation the last generation to ever have to battle cervical cancer, which is amazing if you think about. But unbelievably, cervical cancer rates are on the rise worldwide. As part of my advocacy, I've been able to volunteer with ACS and ACS Can. I've told my stories at many of their local events. I've gone to Sacramento and to Washington, DC for lobby days and met with my congressmen and women. I have told them my story, and I've successfully lobbied for millions of more dollars for cancer research funding, both statewide and locally. What's so incredible and unbelievable to me is that if the HPV vaccine had been available when I was 11, I would not have had to endure anything that I have gone through. I would not have gotten cancer at all, ever. People are always asking, how can we cure cancer? I'm going to find the cure for cancer. But the HPV vaccine is better than a cure for cancer. It can prevent cancer from ever occurring. If there were a vaccine for breast cancer, women everywhere would be lining up for it. And it should be the same for the HPV vaccine. I am here to tell you that any side effects you may have from the HPV vaccine are far easier to tolerate than any treatment for cancer. Tell your parents, tell your friends, tell your siblings to get the HPV vaccine. I speak out now every chance I get. I speak out to spread awareness. I speak out so no one has to go through what I went through. And I speak out for my friends who can no longer speak for themselves. Thank you.
Okay, then I thank you so much, Anna. That was wonderful. Thank you very much. If we were in a live audience, there would be a warm round of applause right now. Thank you so much for sharing your story. Now, as getting back to the segment, again, we apologize for the technical difficulties. Our technical person is in our ACS Alameda office, and the electricity went out. So I'm having to step in to do the slides. So give me a second and I will once again share my screen. Hold on a second. And let me know when it pops up. And I will put it on slideshow. Oops. Slideshow from the beginning. Hang on one second. Oh, not from the beginning, but let me go back. Sorry. So let me just move on. There we are. Adnan.
Thank you so much, Anna, for sharing that story. It means a lot, honestly. I know that's not easy. Thank you so much for sharing. I will now turn it over to Dr. Janet Lai. Dr. Lai is from the Midwest and has been practicing medicine at Kaiser Oakland for 16 years and counting. She's also medical director for outpatient quality, particularly on prevention of cancer. She is passionate about health promotion and community wellness, which is especially important during COVID. Dr. Lai can't wait to one day go back to in-person community events like health fairs. She has 3 kids, ages 9, 11, and 12, so her home life is always full. Go ahead, Dr. Lai.
Thank you, Adnan. And I wanted to also say thank you, Anna. My condolences for you to losing your friend this past week. Thank you for being with us tonight. Thank you for sharing with us how HPV and your experience with cervical cancer tremendously changed your life. And I'm very humbled by what you went through, what you're going through now, and how this vaccine can really prevent us from cancer affecting our children and our future generations. And I honestly look forward to a time where we no longer have to deal with cancer caused by HPV. So let's now talk about prevention. You've heard about the vaccine, you've heard how well it works. What are some other ways to prevent HPV? So there are a couple points here. The first one is to stop smoking. The more a person smokes, the higher their chance that they're going to test positive for HPV. And there's various reasons for this. Smoking can increase the inflammation in our bodies, make it harder for your immune system to fight off infections. And then even those who have never smoked themselves, were just exposed to smoke as a child, have a higher chance of abnormalities on cervical screening, for example. And then I wanted to also say that vaping or e-cigarettes can also increase risk. So don't even start vaping. It's not a safer alternative to cigarettes. The second point is to avoid drinking alcohol heavily. So we recommend no more than 1 drink per day on average. So that would be coming out to 7 drinks or less in 1 week. We know that excessive amounts of alcohol could increase the risk of becoming infected with HPV. And at Kaiser Permanente, we have specialists and programs to help you if you feel like you are drinking too much. And you can start by talking to your primary care doctor. The third point is to practice safe sex and to use protection and get tested regularly. So limiting the number of sex partners is one way to approach it. The more partners that one has, the higher the risk of getting HPV. But I really want to emphasize that even if you have 1 sexual partner, you can still develop HPV. Anyone who's been sexually active can be exposed to HPV. When you have sex, make sure to use a condom or other protection, and then also ask your partner to get tested regularly too. The fourth point is to get screened, cervical cancer screening, formerly known as a pap smear. And you're going to hear more from Dr. Barnhart tonight about the importance of regular cervical cancer screening and the importance of following up on abnormal results. And then the last point I wanted to make is stress and wellness. There is an association with that. So as I discussed earlier, chronic stress on the immune system can affect it from fighting off infections, from fighting off viruses. And so I wanted to encourage you to have a healthy plant-based diet, a diet that's low in saturated fats and sugars, and one that's rich in fruits and vegetables, and to also get regular exercise. A lot of us are working from home or just nailed to our desk on the computer. And so getting regular exercise, at least 30 minutes a day, is good for your body. And additionally, if you are stressed, make sure to talk to your primary care doctor. You might benefit from speaking to a therapist, or at Kaiser, we call them behavioral medicine specialists, and also using available resources. For example, Kaiser members do get access to the Calm app for free. So those are some points about prevention. And I am going to pass it over now to Adnan, who's going to introduce our specialists. And our specialists have seen long-term consequences and complications of HPV infection, Dr. Wang and Dr. Barnhart. Thank you.
Thank you so much, Dr. Lai. I will now turn it over to Dr. Carolyn Barnhart. Dr. Barnhart is originally from South Florida and did her medical education on the East Coast. She then moved to the East Bay to continue her residency training in obstetrics and gynecology, OBGYN. Dr. Barnhart's primary focus in her career is on women's health, of which HPV prevention plays a crucial role. Please welcome Dr. Barnhart.
So Anna covered a lot of the statistics I was going to cover, but I'll briefly run through it, really wanting to highlight that HPV is pretty much the most common STD or sexually transmitted disease in the United States, infecting over 14 million people per year, and we don't routinely screen men, so that's probably an underestimate. And as an OBGYN, I focus pretty much on cervical, vaginal, and vulvar cancers and prevention of such. And each year, about 12,000 women are diagnosed with cervical cancer, and so it's something that we really focus on. Go to the next slide. And so I want to talk a little bit about what HPV screening looks like, as well as kind of what you have to go through to prevent HPV, and as well as what you have to go through to kind of get the diagnosis of cervical cancer in general. So once you hit 21, we recommend that everyone go to their OBGYN and start getting cervical cancer screening, aka Pap smear. It's not fun. You go, you put your feet up in the stirrups, you have a speculum placed, and we do basically a tiny little swab of your cervix. And if you have no HPV, then we only test you every 3 to 5 years, kind of depending on your age. If there's any abnormalities at all, we often like to take a closer look or do a repeat Pap smear, and we do this by doing a colposcopy, which is that middle picture, where essentially we take a little biopsy of your cervix. And if there's any abnormal cells on that biopsy, then what we do is we want to remove those abnormal cells, which we can do by a LEEP procedure, which you can see on the right, where essentially we kind of burn those cells off. And so that is how we prevent cervical cancer. And of course, if you don't get the Hpv vaccine, or if you aren't attending regular cervical cancer screenings, you're much more likely to kind of present to your doctor with cervical cancer. And if you get cervical cancer, the primary treatment is excision, or cutting the cancer out, which we do by removing the uterus and the cervix. Next slide.
Oops, did I go too far?
That's perfect.
Is it perfect? Okay, sorry. There we go.
And this is a huge surgery to undergo. And depending on the stage of cancer that you have and how early it is, we might just remove just the uterus, which you can kind of see a picture of the uterus, or we might need to remove even more tissue. And the more tissue that we have to remove, the harder it is to recover from, and the longer it takes to feel back to normal. Next slide, please. And we say cancer, and typically the thing that pops into mind is chemotherapy and losing your hair. But just getting a surgery or getting radiation or chemo, there's a lot more complications that people live through every day. So you might get the surgery, and then after the surgery, you might have lymphedema or swelling in your legs or arms. You might have bladder dysfunctions. You might kind of have passages created between your bladder and bowels, or bladder and vagina. You might get infections. So it's something that, we say surgery, but surgery is a big deal, as Anna explained earlier. Next slide. And here I'm putting pictures just to show kind of what some of these things can look like. On the upper left, this is someone's abdomen, and when people have very advanced stage cancer, sometimes there are passages made between the bowels and the abdomen as a result of the cancer, and you end up having an open abdomen and a wound vacuum, which is what is pictured there. You can also get, as I said before, pretty bad swelling in your legs. You can kind of see that on the bottom right. That's the lymphedema. And then as part of some treatments for cervical cancer, it's called brachytherapy. And you can see how uncomfortable that looks. Essentially, you're sticking kind of radioactive wands, I suppose, into the vagina. And so it's nothing to sneeze at, and why preventing HPV is extremely important. Next slide. That's why we encourage the Hpv vaccination. It really works. Next slide, please. Right now, we are offering the 9-valent vaccine, and it is extremely effective at preventing HPV and then preventing getting cervical cancer and preventing all of these downstream surgeries and complications. And it's approved now for up to 45 by the FDA, and we recommend that everyone get vaccinated, ideally before sexual exposure, but really anytime that you are available to get an HPV, that works for us. And so I'll pass it back to Adnan.
Perfect. Thank you so much, Dr. Barnhart. Lastly, I'll turn it over to Dr. Kevin Wang. Dr. Wang is a head and neck cancer surgeon here at Kaiser East Bay. He did his training at New York University and then further specialized in head and neck cancers at the Mayo Clinic in Arizona. Dr. Wang has been at Kaiser for 10 years now, and he gets exposure to a great deal of HPV-related cancers of the throat. Please welcome Dr. Wang.
Dr. Wang, are you on mute?
Yep, sorry, I couldn't find how to unmute myself. Thanks so much for having me. Thanks everyone else for presenting. I really am learning just as much as I think I'm going to be teaching today. Advance.
I'll advance it. Just let me know.
Okay, go ahead and advance this slide. So I'm going to talk about one of my patients today, and don't worry, I have his permission. In fact, he's asked me to share his story. So this is a patient of mine who I first met several years ago. This is David and his wife. He was 46 years old when I first met him, and he had a cancer in his right tonsil that had spread to lymph nodes in his neck. This cancer was caused by HPV. He was a healthy guy. He had never smoked. And when I met him, he was engaged to be married. Next slide, please. So he underwent kind of the standard treatment for this cancer, which is radiation and chemotherapy. Patients who get radiation of the head and neck get these custom masks made to kind of immobilize their head and neck in the same exact spot every single day. And as you can see, that's pretty kind of claustrophobic inducing. And they get chemotherapy, which is pretty toxic. Next slide, please. And after he finished, he actually got married. Next slide. But unfortunately, 6 months after that, his cancer came back, as you can see on this MRI here. Those are the measurements of the cancer that had returned. And as a heads up warning, I'm going to be showing some graphic photos of surgery. Next slide. So to deal with his cancer, we had to split his lip and his jaw open in the middle. Next. To allow access to the back of his throat, where we took out the cancer. And that blue vessel loop there is around his carotid artery. Next slide. In order to reconstruct him, we take his forearm tissue and transfer that into his throat. And then take a skin graft to cover his forearm area. So that's a big surgery. Next slide. He actually did pretty well and recovered and went home after a week. And then 2 months later, they had a baby girl. Next slide. But unfortunately, his cancer came back yet again. Next slide. And at this time, he opted against any further surgery and went on some immunotherapy, but his cancer really just took off and grew rapidly and filled his entire throat and was starting to grow into his brain. Next slide, please. And he and his wife actually invited, myself and my partner who did his reconstructive surgery, that's Dr. Moon, over one day. They are having sort of a celebration of his life, and I'd never been invited to a patient's house before. And but how could I say no? And I went, and it was oddly, sad, but in some ways kind of peaceful at the same time. And as you can see here in the close-up, the right side of his face is paralyzed. He's holding a pen there because he can't talk anymore, and so he's writing. And there's a feeding tube there because he can't eat. And so he's one of the worst patients I've had with HPV caused cancer, but certainly one that sticks out in my mind. And so, the HPV vaccine should prevent that. And that's why it's so important to get. Next slide. As everyone said, this HPV causes 6 different cancers and warts and other things. And so, next slide. One thing that wasn't mentioned by the others is that while we generally think of HPV as sexually transmitted, I don't know that that's the only way. So they've done studies on normal, healthy young people where they've swabbed people's mouths and their genitals. And in fact, they found that HPV is living in about 10% of men's mouths and 4% of women's. And in the genital areas, it's even higher, almost half and a quarter of people. And even in kids, they found HPV just kind of living there. And so, again, just another reason to get the vaccine. Next slide. Again, everyone has said this already, but it's a super duper safe vaccine. It's been well studied. Next. Next, it works. Unfortunately, the vaccination is not taken up as much as it could be. In Kaiser, we're doing a really good job, actually. But because a lot of kids were older than 11 or 12 when it first rolled out, a lot of these older kids haven't been vaccinated. And so there's a lot of late teens and young adults who are unprotected and who could still get that vaccine. Next. And again, it's HPV vaccine is cancer prevention. Thank you. I think that's it for my slides.
Yes. And now we're moving on to the Q&A segment. Jessica, do we have any questions or comments in the chat we'd like to share before we move on to the questions we received in advance?
I didn't see any in the chat when I spoke to Jessica as well. So I know the ones that we had received prior to, we can start there.
Okay, so I'm gonna stop sharing for now and start with the questions. Give me 1 second. Okay, so I'm gonna ask the first question here. What should I do if my doctor doesn't recommend the vaccine or advises that I don't need it?
Oh, I can answer that.
Anna.
My answer is get a new doctor. I don't think that any of the doctors at Kaiser would ever not recommend getting the HPV vaccine unless you are over the age of 45, in which case the FDA has not approved it. But I also want to say, going through the health journey that I've had to go through has really taught me that doctors are great, and I don't want to, no offense to any doctor on this panel, you're all amazing, but you know your body better than any doctor. So it's okay to advocate for yourself and to say, no, I really want this. And if you're not going to give it to me, I'm going to go get a second opinion from someone else. I was so scared to get a second opinion. When I first got my cancer diagnosis, I thought my doctor was going to be mad, think that I didn't trust her. And then through the whole journey that I went on, I realized that this is my body, it's not their body. So if I feel like something's wrong, or if I know that my body needs something, I'm not afraid to tell any doctor, you're wrong, this is what I need. And I just encourage everyone to feel that way with their doctors, because doctors go to school and they know so much, but you know your body the best.
Thank you, Anna. That was wonderful. I love that message of empowering yourself and advocating for yourself. Thank you. Okay, so let me move on to the next question. I received my first shot at age 15. I am now 18. Should I restart the series? Who would like to tackle that one?
So I can take that one, Juliane.
Great.
So usually with any immunization, you can just pick up where you left off. So even if you got your first shot a year or two ago and it's beyond the time, you can still pick up where you left off and get the second shot after that.
Great. Okay, and this question, I think Dr. Barnhart you could address this one. If I get the HPV vaccine, do I still need to have a cervical screening test, a pap smear? Are you on mute, Dr.
I was
Barnhart?
muted.
I'm sorry. Okay, go ahead.
Definitely, even if you are fully vaccinated, the vaccine is wonderful at preventing some of the most dangerous strains. But there's over 150 strains of HPV out there. And vaccines, even though they're extremely effective, aren't foolproof. And so it's always good to go get checked out. And especially as Anna was saying, if you feel like anything's wrong, you don't necessarily, if you feel something's wrong, go to your doctor, but definitely stick to the screening protocol. It has significantly decreased the number of cervical cancers.
And I would just add that, it also is going off of what Dr. Barnhart was saying, that even if you were to get vaccinated at the age of 20, 25, 26, you could have been exposed to several strains prior to that vaccination as well. So even though you may be protected from strains that are covered by the vaccine, you may have been exposed to other strains prior to, which is why it's important to continue to get your cervical cancer screening.
Perfect. Thank you. And here's a question, I think, for Dr. Wang. Is there a screening HPV test to check for head and neck cancer?
Yeah, great question. I mean, the short answer is no, not really. I mean, there's stuff being done kind of at the research level, but really nothing that's, I think, really close to being used. The problem is the tonsils are sort of a different kind of anatomy than the cervix. And so even if you sort of swab it or rub it, like the cells deeper down where you can't reach is sometimes where the cancer starts. So the short answer is no, there isn't, unfortunately.
Right. And my understanding, Dr. Wang, is that, well, all the doctors, is only cervical cancer has a screening. All the other HPV-related cancers don't have a screening. Is that correct?
Sort of, or regularly scheduled screening, that I believe is correct, but there are some special populations of patients, or if you notice an abnormality in your genital area, we do kind of regularly monitor people for vulvar cancers that are HPV related if they had a problem on their vulva. And the same goes with kind of immunocompromised patients who do have warts, genital warts from HPV. Sometimes we will do anal pap smears or vaginal pap smears, or the equivalent to that.
But the key to that is that they need to be current with their medical visits, right? In order for that to happen, yeah.
It's not a routine screen the way that you would think of a colonoscopy or.
All right, thank you.
Seems
Juliane,
like we have
there's a question.
It's saying,
Oh,
from Esther, are there any studies underway for HPV screening in men? I'm not sure that there are. I know there's no real way that, as Dr. Wang was mentioning, there's no real way for screening in men for HPV. Does anybody have any other ideas? I don't believe so.
Yeah, there are not.
there are none. Okay. All right, so let's move on to the next question. Just had a birthday. I'm now 27. Is it too late for me to get vaccinated?
I can take that one, Juliane. So as Dr. Khan had mentioned in the beginning, it's been FDA approved up to 45. And so I would just suggest to that person to talk to their primary care doctor, and likely it would be fine to go ahead and get the HPV shot then.
Okay. And let's see, another question here. The last one, I think Dr. Barnhart, this is for you once again. If I get the HPV vaccine, do I still need to do a pap smear, cervical screening test?
Definitely, you should still do the cervical screening test. The HPV is preventative, but it's not 100%, and you might be exposed to the other however many strains out there, and we want to be as safe as possible and catch anything abnormal when it's still really, really treatable, without having to wait till it's very advanced and you have to undergo really rigorous surgeries and other treatments.
Okay, great. Now, I just we're gonna close the event. Thank you all to our wonderful presenters, Anna Reyes and the medical experts. We appreciate it. And thank you all attendees for joining us, taking the time off your busy schedules to join us tonight. I just would like to just close by sharing that in the next few days, and probably by tomorrow, you will be receiving a follow-up email that will include a list of resources. This list will include online links as well as information to the American Cancer Society Live Helpline, 1-800-227-2345. And again, this will all be in writing in our follow-up email. Know that our Live Helpline is available 24/7, 365 days of the year. And we have trained cancer specialists who are available to address any questions you may have after tonight's call. So feel free to, look out for the email. We will also be including the recording link of tonight's event. I hope those of you who have joined us have been inspired by Anna Reyes' story, by her advocacy spirit, and will help get the word out. We are ACS, we are always looking for HPV champions in the community. So a way to do that is to share the recording link and share the information you've obtained tonight to everyone you know, your friends, neighbors, colleagues, everyone, and help get the word out about the HPV vaccine. Thank you again, everyone, and have a good evening.